it is a safe. It wouldn't be. No one will risk. No government and no scientific researcher or doctor will risk their career or the population of their country and saying that is safe when they know that it's not safe. So it's all about making your own informed decision by going to the right websites and just making sure that you go through the science of it. So your question is absolutely the right question to ask. And it just, Happy Healthy Coventry is one of the websites, and it will direct you to a lot of other relevant websites.
Thank you. I'd like to ask a question. We know we have 4 approved vaccines based on, we've got the Oxford, AstraZeneca, we've got the Pfizer, we've got the Moderna and the Janssen, if I'm correct. I'm reading this off the UK gov.uk. In terms of, so many people have asked this question, if I take any of these vaccines in Africa, am I sure I'm getting the right or the genuine ones? So if I'm not very certain about that, if I come into the UK, do I need to take another one, just to be safe? So is it safe to be, if I've had double jabbed back home in Africa, to come here and get double jabbed again?
Okay, so that's good question. I'm from Libya, so Africa again. So, and I can totally understand. With vaccine, there is a bit of what we call cold cycle, and it can be broken at any point. So if you're not sure about, here in the UK, we take it really serious with the cold cycle. So the vaccine is getting the cold chain properly, so everyone knows check the temperature and make sure that it's being kept in the right temperature all the time. If you're not sure, no one will say you can't have it. To be on the safe side, would rather everyone is safe rather than not sure.
The way that the vaccines travel around in this country, so they get manufactured in the factory, they're sent out to and that has a special fridge system in there, keeps all the vaccinations cool, and then they go off and distribute them to the depots where they need to go to local areas, like vaccinating sites, and they're all travelling at the same temperature each time. And when they get to the GP surgery, they're still at the same temperature, and then they're put in the oven. They're given at that temperature that night.
Yeah. So they are. Yeah. It's especially with the Pfizer, which is, I think a lot of you will be having on your Pfizer. It's the temperature that it needs to be kept in is a very low, and it's very difficult. Yeah. So it has to be a special freezer, and then it comes to the surgery, and then it defrosted over a certain amount of hours, and if it doesn't, we throw it away. That's why we try to, so just because we know that it's not used, once that temperature, once it stays defrosted for that length of time, we can't use it. So we follow all the regulations here. So, but if you're worried, by all means, just have it again.
Just ask, and the vaccine, once it's been taken out of the vial, it has a 6-hour shelf life. So we've got 6 hours to get people pushed through, get them jabbed, and because we don't want to waste them. The last thing we want to do is chuck any away, because people should be having them.
Yeah.
Yes. Was the Pfizer vaccine so effective in Africa? Because our temperature there is totally different from temperature.
No, it's not about the temperature of the country. It's about the temperature of the freezer. So if they kept the freezer, the fridge and the freezer, so they have to be at -30, I think, for Pfizer at the initial process. So it comes to the surgery from the freezer, in the freezer, you know what I mean? And then it defrosted over time, and that's when it's defrosted, it's in the fridge. So if we keep an eye on the fridge, it's not about the temperature outside, the temperature of the fridge, which is like between 4 and 6.
whoever's taking on being given the, whoever's, while the vaccination boxes, while the vials are being transported from here to overseas, they're all transported at the right temperature. The vaccinations, they come with guidance. It's like a guidance sheet that, so when they get to Africa or the other countries, it's up to the officials to make sure that the vaccinations are then followed through with the correct temperature to each area. So they must have those fridges or freezers
Yeah.
in place. They will have been told.
Everyone
that
will have
done.
to do that. You
Yeah.
Just it's. I'm not. Not questioning So in every country, they have to follow the manufacturer guidance, and the manufacturer will support them in making sure that these. If they need fridges or whatever, or freezers or whatever, they will help them with that. But I'm talking about someone who said that they're not sure. If they're not sure, I mean, no one will say no, you can't have it, because we don't have the documentation for that.
Sorry, I was just going to, sorry to interrupt. Just before we go on any further, is this a question being asked because someone's heard or seen something online? Okay.
Yeah, so the temperature in Nigeria is quite high. We're just following what you're saying. Actually, I agree with because actually you see a lot of people buying online.
Yeah.
Oh, okay.
Okay.
Right,
But
right.
that's something we can't.
We've
I mean,
got
I
no
can understand
control.
because I know where I am. Yeah, where I'm from, we can hear and see some stuff, but we can't. Yeah, we can't comment
Yeah.
on other places. You see what I mean? So
From
if you're not happy or you're not sure,
Yeah.
you can have your vaccine here. No one will say no.
from the UK, the vaccines will go over with the guidance from the manufacturers. The vaccination you get here will be followed through with the correct guidance as set out by the manufacturers. So it'll be at the right temperature when you have it. Yeah. Sorry, you wanted to ask.
Good afternoon. Thank you for this. I have one question at the moment. It's public knowledge that the World Health Organization and the other affiliated bodies have kind of made themselves immune to lawsuits from any injuries that may occur from the vaccines. Can I know why? If they're so sure that these things are harmless, they would indemnify, or I don't know if that's the right word, but they will make themselves immune to lawsuits, being so sure that this is safe.
I'm not immune to any lawsuit. Okay.
No, I mean not you.
Yeah, I know, no. What I'm saying is I haven't seen that lawsuit or the immunity, and I'm promoting the vaccine, and I have no financial or whatever. The only gain that I'm going to have is a reduced pressure on the NHS. And making sure that we see people who need. I mean, a lot of people who get vaccinated, we're not going to see them because of COVID. We'll see them with other things, absolutely fine, but they wouldn't need. I mean, basically reducing death and reducing suffering of humans.
Yeah.
So I can't comment about myself. I can comment about myself and my immunity to this, and but I can't comment about an immunity that I don't know about. So I have to say. I need to see a document, and need to see a genuine document to believe it.
All right, that's fair. I mean, it's like widely known. I mean, even the World Health Organization have not refuted that claim. I mean, they would do that if it was a lie. But yeah, I understand that. Yeah, I mean, if I was to sue the producers of the vaccine, say Pfizer, Moderna, if I got any injuries, I wouldn't necessarily come to a person who was disbursing the vaccine. I would go sue first Pfizer, Moderna, and so on and so forth. But they are immune to lawsuits. So that's what I'm saying. I wouldn't sue you. I would sue them, but I can't even do that if I got injured. Yet they say I'm supposed to take it and it's 100% safe. I don't understand that.
I really can't comment on this. I think it's what is the thing is if a doctor gave you something and it happens to you because of anyone who gives you the thing that causes the side effect, and the decision is from the government and from the national body to control vaccine and medicine. So that national body in the UK is responsible for the yes that we can have the vaccine. If anything happens to you, you can sue them. No one is immune. Okay, so the decision is in the UK for the UK population. We do not. Okay, everyone will follow the WHO. That's for sure. But for the UK decision was based on the national body that control the medicine, so it's not related to anyone else. So if anything happens, and that's why they didn't approve it until they studied everything and all the literature and all the experiments or all the trials before they said it's yes for the adults and then yes for the 12 and 15 years old.
So the body that Mai is referring to is called the Medicine Health Regulatory Authority.
Yeah.
It's the MHRA. Yeah. So they're the ones who have got all the evidence around all the clinical trials and how it was all kind of, set up. And so if there is anything that's of real concern, please do, contact them.
And it's very important that anyone who have side effects to tell people there is something called the yellow card that you can fill in and write that down, and just because it's very important for us to know as well. It is something that's new, but it's been used now for over a million. I mean, at least over a million. And we know that it's at least, yeah. So, but yeah. So.
Questions need to be asked. I have a friend who got the vaccine. Her menstrual cycle got messed up. Well, now this is not to the point of death, of course, but something that hasn't happened to her in about 5 years began happening to her. I didn't really ask for much details, but these are things that have genuine people have genuine concerns and things like that. And I know I'm not the only one who sees this. We don't live in the bubble. People are being censored for asking questions. So with this happening, you can understand the skepticism. Plus, I can't sue nobody if anything happens.
Yeah. So I think the most important thing is to write that card, the yellow card for, as I said, menstrual cycle disturbances or any side effects that you think it's from the vaccine. Definitely, we would like to see them. And the more we have, the more we know that these are side effects. So there is no censoring.
Just read something like that. But what I would like to say is this: it's not only the vaccine. Like, it's not only at the vaccine. If you have side effects from taking the vaccine, then you can't sue Johnson & Johnson or whichever company that made it. There are other drugs too that is not related to COVID, that if you take and you have side effects, you may not be able to sue the company for as well.
Absolutely.
So it's
whoever gives the decision to give the drug and whoever gave the drug that are responsible, because that's with even paracetamol, side effects happen even from a paracetamol infusion, and if that happens, you're not going to say sue the drug company. It's who gives.
Usually the packet of medication or drugs that you have, it has a long list of disclaimer side effects.
Yeah. So, but hands up. Yeah, absolutely. Yeah.
Okay. We've got some viewers online, and one of the questions that came is the vaccine safe for kids, for children, at what age, and is it safe for them?
Everybody there in England who we can't say a drug is, I can't as a doctor say a drug is safe until that body said that this is the right thing to do. So for now, we know that it's safe to give for 12 to 15. So from 12 years old and above, anyone can have the vaccine. There will be some side effects, but it's the risk of having COVID infection is worse than not having the vaccine. So we're trying to protect lives. We're trying to reduce suffering. But yeah, we know that having the vaccine, for now, we know that having the vaccine is the best option here for 12 years old and above.
A question, I took the first vaccine about 7
Mhm.
So if I want to take the vaccine now, I'm in the 7 years. Do I have to start all over again or I can take the 7 years?
I think Yeah, you can have your second dose now, and then even the booster, even if you're going to have the booster dose, it will be 6 months later. So yeah, definitely you can have your second vaccine dose now.
When did you have the first one?
She said 6 months ago.
6.
Yeah, 6 months. Yeah. So definitely you can. It's over 8 weeks, so that's fine. Can I ask how many people are registered with their GP here?
Sorry?
Okay, GP registered with GP. Okay, so you're all covered. Oh, sorry. Yeah, it just make sure that you're registered with your GP. Make sure that because it's all because of your. It's not about vaccine. It's about all your health. General health basically, and it's just making sure you will get the reminder for your vaccine, for example, reminder for other health condition. Make sure that if someone gets unwell, instead of going straight away to A&E, you've got your GP, your pharmacist to contact. A&E is really busy at the moment, and we really need to reduce the pressure on the NHS. If you need it, you go there, but if you don't need it, call 111 or see your GP. That's just part of how it is. Yeah, sorry.
So I have 2 questions in mind. The
Go
first
on.
one is, why do people who have had 2 shots of vaccine need to self-isolate for 10 days again when they get to the UK? When you have, from what I read, once you're vaccinated, you can't then spread, but you can't spread it. So why then do you need to isolate for 10 days?
Okay, yeah. Now, if you have the vaccine, if you had the vaccine, you will not get a bad COVID infection. Okay, you will have a milder infection than what would have happened if you didn't have the vaccine. Okay, but the fact that if the problem is if you've got an active COVID infection, it will be less active, but you will still spread the infection. You will not spread it as much as people who haven't got the vaccine. So the viral dose will be less than if you didn't have the vaccine, but you still are a potential source of infection to others.
I know it's safe for to get vaccinated, but then does the vaccine also cover like the choice that when the child is doing that?
So a good question. Okay, we don't know. That's the answer. I'm going to say. What we know is the vaccine is safe during pregnancy, and the danger zone for a pregnant woman in terms of COVID infections throughout pregnancy, but it's mainly the last few months of pregnancy and the first few months after the baby is born. And it's very important that pregnant ladies get vaccinated, because it is a critical time when you have 2 unwell patients, the mum and the baby, and we don't know what will happen to them, and we don't care for them in Coventry. We have to take them to Leicester because of the specialist machine and how unwell they are. So it's very important to take the vaccine. For children, even children under 12 don't take the COVID vaccine. So they're not going to be vaccinated until they're 12 or they've had so they're not. We're hoping that the breastfed babies will have the immunity of their mum for the first 6 months, so that's a good thing. And we know that COVID infection is usually milder in children, so there's no need for it.
Things like this, or are we just streamlined to vaccines alone?
Okay, there are a few trials that's going on, okay, for drugs to be used for. Oh, the question was, are there any drugs that are used for COVID vaccine, for COVID infection? Okay, so the only thing with COVID infection is, and that's the main reason why vaccine is our only way to fight this infection, is we don't have a clinically approved drug that we can give to everyone for COVID vaccine. There are some new drugs, new trials are developing. There are some drugs that have been used for other medical conditions that are being used now, but they are extremely expensive, not for, we only used for people who are high risk, really, and just because they are very expensive at the moment, or they are under trials. So there's nothing for the general people use. It's only for people who are admitted in hospital and under.
The normal lifespan for trials as far as vaccines is about 9 to 10 years. Is that right? Normally.
Can you repeat that?
The normal trial period for vaccines to be classified as safe for taking is about 10 years. They're about prior to the COVID vaccine, isn't that so?
Yeah.
Well, when you're testing vaccines, basically to establish that they are safe for use, the normal period will be about 9 to 10 years, isn't it? Yeah, I think that's the lifespan for testing, isn't it?
It's mainly because of consenting, and yeah, so that's the trials. That's because we can't take a child from school and say that we're going to run a trial on you.
No, I don't mean 9 to 10 years old. I mean that the vaccines have to be tested for that
10
long.
years. Yes,
exactly.
Yes, yeah.
Exactly. So although I understand, no, I would just say I really understand why it's hastened, because even the World Health Organization said we have a 99.9% chance of surviving it. So with that being said, why are we rushing this? Because in a sense, it's experimental by considering the trial period and how quickly we are having to take it according to what they're telling us. This is about 1 to 2 years since the vaccine since the COVID began. And we've not tested these things long enough to establish they are safe in the long term. So we may not have things happening to us now. How shall we things will happen 5 years down the line, 10 years down the line, considering we've not tested this for the period for which it's meant to be tested?
I see your point here. It's as you said, usually that's what happens, but the mechanism that the vaccine was developed, the mechanism itself has been there for a long time, and they were waiting for that time when they need to use it. That's one thing. The problem with COVID vaccine, the amount of deaths that happened at the same time last year, we don't want it to happen every year. And we can see clearly the difference between the death rate with this vaccine, without this vaccine. It's all about, is it all right to watch your patients die while we're thinking we'll have to wait until 10 years down the line and see how many people died and how many people survived with the side effects or not. So it's a decision that's made, not because we know, but it's the trials have been done. The vaccine is safe. But they've tried it on a large number of patients, and it's safe. And then whatever happens to the majority of population will happen to the majority of population. It's not like
Okay, I've got one question here. The question says, there's been a lot of rumor about the vaccine tampering with the genes. Yeah, in Africa, we are very superstitious. If you take something that you just tamper with your genes and turn you to something else, maybe change your makeup or something. I know it's not that extreme, but this is a concern. Apart from dealing with COVID itself, does it have anything to do? Does it tamper with the human gene, or that's
okay? So it's okay. I mean, we know that a lot of genetically modified ingredients are there on the market. I'm not sure about your red pool or whatever. Have you ever read all the ingredients and looked in details on what it is? As long as it's safe and it serves a purpose, that's why we take things. Now, I'm going to talk about the COVID vaccine. It will not tamper with your genes. It's all about a piece of protein that is similar. The genetic modification happens at the time of making the vaccine. Okay, so they just want to produce a protein, and that protein is similar to, it's not the virus, it's similar to the virus. You introduce it to the body to trick the body into making antibodies to COVID vaccine. So when the body find the COVID virus protein, it makes the antibodies, it makes the response, the immunological response that we wanted to do to protect the body from having a severe infection. But no, I had it almost over 6 months ago, and I haven't developed any genetically modified things. I'm still the same person. And yeah, it doesn't work on the genes.
I'm not a clinician here, by the way. I'm just a normal general person. So just speaking generally, I've had vaccinations since I was a baby. And I assume most of you would have. So putting this into perspective, we've kind of had vaccinations all our life. I think I'm still okay. Nothing's happened so far. And speaking for the majority of the people across the nation, a lot of them, you know, since they're born, they have all these, is it 6 immunizations in the one go?
Yeah. Yeah.
Polio, yeah, MMR, all these, you know. So it's a part of our makeup, our build for our immune system, isn't it?
Yeah.
But yeah, clinician will probably reassure you on that.
The thing is, it's all about how do you know what are the effect of having a COVID infection on your body in the same because it's a virus. It is viruses work on your DNA. That's how they work. And they spread through your body, make the COVID infection through working on your, infecting all the cells in your body. COVID infection can kill, can cause a long-term or side effects like long COVID, like destroy the lungs of some people. It just decondition a human. A lot of people, we saw them have a lot of side effects. It's all about, at the end of the day, taking the vaccine is your decision, okay? But it's a decision that affects you and other people, okay? And these other people could be your loved ones, and could be the people, your friends, and could be the wider community here. What we want, I don't want to force anyone to take the vaccine, but I want you to make sure that you are making the right decision for you and for your family, for the people you know. I mean, we have made a huge improvement. Last year, this time, we didn't have anything to do, and people would die and we couldn't do anything. A huge progress have been made through, now we know how the illness itself works. We have some drugs to reduce the impact of the disease, but before you have the disease itself, we have a vaccine that stops us having the infection. I think for your age group, most of the time it's not for you, it's for protecting the others around you and for the whole community, and it just working together to avoid another lockdown, really, and to avoid more deaths. The lockdown is no problem, it's mainly deaths of people. I mean, I know a few colleagues who died recently, over the last year. I know a lot of families who lost loved ones, I've lost few patients, and it's all about, if they had the vaccine last year, they might have been with us now. But yeah, no one will force you to have anything you don't want to. But we know science says, and what we see in day-to-day practice is the vaccine saved life. This vaccine saved lives. You can even compare number of infection from last year, this time, to this year. Although we're open now, and we're not that open last year, and you could see the difference in the numbers of deaths and the number of infections. Number of infection, the vaccine will not stop you getting the infection, so that might not be that much difference, but yeah, but that's definitely, we're not seeing that bad infection.
Any other questions? Okay, just going back to the start of your the brief. You mentioned that Coventry and Warwickshire were the first to get the vaccines, and as you were currently, we're in terms of adoption, we're like the last. What can we do? This is one of the reasons why this forum was what can we do to take us from, not necessarily, we're not getting, it's not about a competition or something. What more can we do as citizens of Coventry?
Okay. When we compare Coventry to other areas of the country, to the other area like Solihull or Warwickshire or Stratford, the education level is, Coventry is a student city, or we're still getting educated, but yeah, so it's basically education, letting people know that why we're having the vaccine, this demystifying these myths about the vaccine. And at the end, yeah, I'm not forcing anyone to take the vaccine, but it's all about knowing that people who had the vaccine got protected, people who didn't, if they, you're lucky that you might not have any complication from having the vaccine, but you might, of the virus, but you might transfer an infection and cause lifelong consequences of not death to other people. So that's the message that we need to send to everyone. And if we get more people vaccinated, that will give us, we'll protect ourselves and protect people around us. And let's not be selfish and just think about ourselves. Think about your city and your people as well, your family. Okay. Okay, yeah. So the vaccine, you can, if you're registered with your GP, they will send you a message when it's time for you to have your first dose or your second dose or your booster dose. But there are a few places in Coventry where you can walk in and have the vaccine. If you go on the I'm sure.
Well, I'll send you the link, Kingsley, and then if you can share it with the entire group, and it's got the link shows you where all the vaccination sites are, and some of the sites you can just walk in. They have specific opening times, say 10 till 3. You can just rock up, bring your ID with you, and just say you're here for your vaccination, whether it's first or second dose. And they are offering the Pfizer, the majority of the sites.
Absolutely, yeah. So Happy Healthy Coventry, and that's the website. Yeah.
Thank you very much. Just like
we're here to answer questions, so don't worry.
We are used to like genuine questions. Like you said, that's why we are here. Not the professional presentation. Like I said, these are questions, real questions, and you have to know these things because you have one life to live, one body to do this. So make decisions based on the long time.
Yeah.
So we need to have all the conditions going to clear out over everything. So
yeah, absolutely. Yeah, don't worry, because we get these questions. I have patients come to me and why are you wearing this? So we have to we have to respect your decision and anyone's decision, and it's asking questions is the right way to understand more about what's going on, and if we can be of any help, that's absolutely fine.
So if anyone else hasn't got a question, but I've got a question for the group. So do you think today's session has kind of given you some understanding and those, the facts around how the vaccination works, the side effects, the program itself? And I don't expect you to answer my question straight away, but do you think you may consider go back and think, oh, hold on a minute, that was right, and I'm going to have the vaccine now, sort of thing? Is that something that you may think about? You don't need to tell me now, but
the most important thing is if you've got any questions, by all means, I think I'm happy to say, if you can send it to Suman and Suman can send it to me, we're happy to answer any questions. And stay safe and good luck with all of your studies, and nice meeting you.
Thank you.
I'm here if you've got any other questions.
Thank you, everyone.
All right, thank you. Just last words. One of the things that we'll do as a group here is that we'll keep a channel open, like a discussion forum. So anyone who's got any questions or any concerns or anything, you just drop on the channel, and if you want as well, we'll connect you to the channel. So as the questions and things come in, we'll just
That will be great, because
Filter out who needs to answer.
I'm only a GP, but we've got an immunologist, a virologist,
Mhm.
public health consultants,
Mm.
and if someone can bring the question to the group,
Yeah.
they will have a better answers than me. Yeah.
All right. So the focus group doesn't end here. For say we're ending the meeting now, but other discussions and deliberations and questions and answering can go for from now. I know there's some people watching us online. They could ask most of the questions, but on that forum, they'll be free to throw in their questions and anything. Do you want to say something?
No, so definitely, yeah, absolutely happy to. And please spread the words, just save the world if you can.
All right. So one more time, I want to thank you for taking out your time to come into us. And to the participants here, thank you for your taking time from your busy schedules. And for our online viewers, thank you for following us. We recognize you as well. And so for now, we call it a day. And I'll just call Sam to just say a few words from the society. Thank you.
Can we just put our hands again for our team? This inspires. So mainly we're a society, like I said earlier, when we began. I would just like to use this opportunity, just as we are closing, to encourage us to go onto the CUSU website and sign up to become a member of the society. So it just takes £2, and then it enables us to have meetings, because as a society, there are certain restrictions the university. So the society. So it will be very great if we can go onto the CUSU website, that's the Coventry University Student Union, and then sign up to become a member. And that's it from me. Thank you very much again. And
So we've got some light refreshments at the back. Just help yourself to. Yeah.
So let's. So we're at a distance.
Okay, so.
We just do selfies.
So guys, I want to just.
We can,
The part of us.
yeah,
One here, in here or after?
in here, yeah.
Okay.
Yeah. So.
Yeah.
I don't know. I'm not.
I'm not.